So if somebody's got joint pain and we switch it off completely, they're not getting the signal that tells them to pay attention and be careful. So they could actually cause more damage. So what I would do in that situation, I wouldn't necessarily be looking to get it down to 0 when they're moving, but I'd let the system work out, get the unconscious to work out what is the right and appropriate signal for the person to get so that they're paying attention. In this case, it might be, walk carefully or don't walk so much, or take some action, such as Tina mentioned, lose some weight or whatever it might be. So they're still getting the signal, but it's not at a 10. Okay, sometimes it's like the car alarm doesn't need to be blasted out. We kind of just need a signal to go, hey, someone's nicking your car. So I would be looking to recalibrate that signal, because the system might be going, no, we cannot turn this down because they're going to cause even more damage if they just keep on walking. So that's what I would look to do with that.
Yeah, I would look at underlying conditions. What is the pain signal telling them? Even do something like 6-step reframing on it to figure out.
Yeah, absolutely. Yeah.
What is the meaning behind that pain? What is it doing for them? What's it telling them? What does it need?
Yeah, and you use the IMR signals as well to go, are you willing to drop the signal down from 10 to a 9? If you go, yes, okay, from a 9 to an 8, yes. And you calibrate it down to a level where the system goes, this is okay. We can willing to reduce the pain, but we're not necessarily willing to switch it off. Yeah. You can also look at not just reducing the pain level, but the pain duration in terms of time. So, for example, would the system be willing to only give the signal for a minute or two, as long as they're paying attention and walking appropriately? Yeah, and let the system work out. So I'd certainly be talking to the unconscious and using IMR signals with somebody in that situation.